Well, October is Breast Cancer Awareness Month, and the simplest thing that you can do to stay healthy is to get a breast cancer screening. Some women are at a higher risk of developing breast cancer, and Michelle Hurley is here to talk with us about it. And you guys have made a lot of headway over at Christus in dealing with this. What makes a woman high risk?
Well, the average woman has a 1 in 8 lifetime chance of developing breast cancer, and there are certain factors that can increase the risk, such as family history, age at first birth, different factors like that. And so we've used genetic counseling and testing and risk assessment with our oncology patients that do have breast cancer. So what we've done is to move this upstream to when women come in for their annual screening, and we have a new 3D mammography unit. So we're taking information from them, putting it into a computer model, and when they leave after their screening mammogram, they have a printout of what their own personal risk is based on this model.
Okay, there have been a lot of changes over the years and maybe some misinformation and confusion about when women should go and have their screenings, at what age. Does it change if you're one of these high-risk patients?
It absolutely does. And why I'm so happy to provide this information is because it empowers women to be able to go to their healthcare provider and say, hey, let's talk about this. I just got this printout and it says 25% risk of breast cancer. And it takes an individualized screening plan. One size does not fit everyone like 10 years ago.
Okay, because a lot of it does involve the genetic testing for it, in
Yes.
addition to those things that we already knew about as far as lifestyle and family history.
That's right. And sometimes we can even give what we call chemo prevention, which are actually medications that can prevent breast cancer. So when we can't prevent it, then of course we want to catch it early.
And that really is the name of the game as far as breast
Yes.
cancer is concerned, is catching it when it's early.
Absolutely.
Tell us about the 3D mammography, because that's really interesting.
Yes, the 3D mammography, I'm so happy for our community to have that now, because it's, one of the radiologists explained it as having a deck of cards, and with the regular 2D mammography, they were taking those images and looking at like the whole deck. And now it makes slices of the tissue so they can look in between each card. And so if there's something very small that's hiding behind a structure that's kind of not easily seen, they can pick it up better.
That is pretty incredible.
Yes,
of course,
it is.
that is helping with diagnosis of breast cancer at an earlier rate.
At an earlier stage. And also another thing with it is that there won't be as many biopsies needed, because on the 2D mammography, things are not as clear, so they may order a biopsy because they can't tell that it's benign.
Mm-hmm. And this is going to cut down on that a little bit.
Yes, and there's a lot of anxiety with getting a biopsy.
Sure there is.
Absolutely.
There's some discomfort involved and all of that, so this
Yes.
kind of cuts that right out of the equation.
Right.
What do women need to provide when they come into Christus for a high-risk assessment?
Well, really just bring yourself there, and most women are going to have the information that we need, and you might not know the exact age that, let's say, an aunt or your mother got breast cancer, but we'll give you information to call us back. And, you know, we have nurse navigators, and I'll leave the phone number for that. And we actually, this Wednesday, from 5:30 to 6:30, we'll have a free class for the community. It's open to anyone on high-risk breast education.
All right, really important stuff, especially during the month of October. We've got the number there on the screen so that people can contact you for further information. We thank you for coming by to talk to us about it today.
Okay, thank you so
Awareness
much.
Month. Yes, ma'am. Well, up next, we're learning how to cook meat pies with McNeese's Leisure Learning. Stay with us.